This is Susan. Susan lost 18 pounds as of today, the 7th of November. She also was taken off her water pill, which I stopped today because her blood pressures were great since she's lost so much weight. And she actually stopped her Amitiza. Amitiza, and these are the other folks in my practice that have been able to stop their prescription medicines, one or another or everything, within the last 10 months. I took over this practice in January of 2015, and I've been able to suggest things as far as healthy lifestyle to patients to help them to not only get healthier, but also, in effect, lose some weight, which is great. So what I wanted to talk about today is with Susan, she stopped her Amitiza. That's usually difficult to do. Amitiza is something that is as a medicine used for irritable bowel syndrome. It's supposed to relax the small intestine, fill the lining of the intestine with fluid, and that way the fiber in the fluid will make you have a regular transition or poop. Regular bowel movements will usually be healthy for a person with irritable bowel syndrome. If you've ever known a person with irritable bowel syndrome, they'll IBS or IBD, inflammatory bowel disease, they'll suffer with just a bite of something that their stomach usually doesn't agree with. And that's a lot of suffering. Pain, bloating, irritable bowel, or at least irregular bowel habits. If you've ever talked to anybody, it's not a great lifestyle. So we try to calm the nerves of the belly down with certain medicines. We try to restrict food, but I think with maintaining a mostly whole food, plant-based practice would be the best thing. Obviously, you always want to make sure that there's no allergic components in the certain food types. And sometimes it might not just be you eat something like a grapefruit and you have an allergic reaction or you have bloating and belly pain. It might be a combination of several things that you wouldn't think about. And that's why sometimes those allergy panels are really important. There are some good allergy panels that are out there depending on the place that draws your blood. There are really fancy ones like, that cost several $100s, and they specifically tell you, they go down to microscopic level as far as, or dilutional level as far as finding exactly what you will be tolerant to and what you should probably stop, and even give you an idea about how to taper off and stop it. So we're not going to talk about that. Assuming that you've all been tested as far as the allergies of the standard foods, or you've done your own withdrawal diet, like the Sinister 7. Sometimes there's a way to get off of the Sinister 7, the different food groups that typically are offending, and I'll list them all here. You stop all 7, and then for at least 3 weeks, you maintain, and then you introduce one every week thereafter, and you see which one is the offending agent, or which week is bad for you. But you can't do that when you're going through holiday changes, or harvest changes, or vacation time, because you're going to be throwing too many variables in that. So that might be a way to do it. If you've done all that already, if you've been ruled out for big disease, and that's where I say it's time to at least beef up on your nutrition. I always say stay away from dairy because of certain components in the dairy products that might be irritating. And even if you don't have a lactose intolerance, I still think that if your bowel is that sensitive, or you have increased permeability in the small intestine, which is also known as leaky gut, then you might want to still stay away from the typical offending agents, gluten, dairy, sometimes wheat. So one should do that. And I think it is important, especially with the project called the Gut Microbiome, the Human Microbiome Project. It was funded by NIH. It essentially talks about the microbiota that's supposed to be existing in your large intestine, and hopefully not too much in your small intestine. And if you have a good collection of healthy bacteria, then you have a good source of fiber for those healthy bacteria to survive on, because they eat bacteria. The bacteria eat the fiber. And then you maintain a regular practice of eating, you maintain a regular relaxation practice, and everything should be great. It's almost like having nanobot technology float around in your bloodstream. These bacteria will have a profound effect on your own hormone levels, your own weight. I've talked about that before in my probiotics video, my fiber video. And you've probably seen this before too. So what's most important is you got to maintain with fiber. And if you can't do fiber with a whole food plant-based diet or a clean and green diet, then you add it to your diet. Fiber for a woman in America is supposed to be at 25 grams a day, for a man 35 grams a day, and I think that's minimal. If you look at some of the healthiest tribes around the world, sometimes with the tubers that they eat, they'll go up to 75 to 100 grams of fiber per day, and their likelihood of early Crohn's disease or heart disease or obesity is very low in those cultures. Unfortunately, infectious disease is high, but that's a different story. Anyway, if you can't maintain at least 25 for women and 35 grams for man, add psyllium. I like psyllium because it's gluten-free. You can get the organic India is actually GMO, non-GMO, but you can also get other forms of psyllium. I don't really agree with Metamucil because it has aspartame and yellow dye number 5. I think those are irritants. But if you do the extra psyllium, not only would it help lower your postprandial sugar level, it will also add more fiber to your bulk, both soluble and insoluble. Insoluble fiber helps you move. Soluble fiber adds coating to the lining of the stomach, the small intestine, and the colon. So the coating that you need is to protect the lining. Lining is very delicate. It's a protein, like skin's a protein, but on the skin we have surface protection. In the lining of the gut we have nothing except for mucus. And if you put the insoluble balance into the gut, it'll protect the gut. And that'll again be fodder or food for those probiotics. If you don't have any mucus lining, stomach especially, then the probiotics that you're taking, any combination of probiotics, and I'll put a link to the probiotic video, will actually start eating the lining of the gut because that's protein. When you have a stomach that's exposed, no mucus, probiotics attack the stomach. When you have a large intestine or small intestine that's exposed with essentially no mucus, that can be in the form of the soluble fiber. It can also be in the form of slippery elm, marshmallow root, DGL. If you don't have that in your diet, then these guys that you're taking, or the standard bacteria that are in your gut anyway, will eat away at your own lining, and that'll cause pain and cramping. Whenever the tube, that 36-foot tube that goes from your mouth to your anus, whenever it's irritated, the only thing the tube can do is squeeze. And it'll try to force the bacteria or the parasite in it, the offending agent, to the next level until it's finally out either through diarrhea or through vomiting. That's the only thing that the tube can do to protect itself. So it tries to do that when there's no mucus or when there's bad bacteria. If you can flood the stomach with probiotic, most of the time the probiotic, as long as it's refrigerated, it has a best used by date, and there's enough, like 300 billion. This only has 5 billion, is my favorite for what I'm taking. Hopefully not all of it will be killed by the time it makes its way to the large intestine. There shouldn't really be that many bacteria in the small intestine. It's more for digestion and absorption. The small intestine isn't supposed to have, and sometimes when it has too many bacteria, then it's called SIBO, and small intestinal bacterial overgrowth. And that could be a very painful problem. So that's why it's important to take the right probiotic and continue with it, especially after antibiotics. But now, because of the gut microbiome project, it's important for everybody, for all different diseases, for fighting inflammation, for increasing serotonin, to have probiotic in. When you have antibiotics in you, Justin Sonnenberg out of Stanford came up with a great study that once you get hit with antibiotics, or once you have a colonoscopy prep, it decreases the bacterial load significantly, and in most of the cases you can't get the bacterial load back again. So with each offending antibiotic, you can decrease your effective healthy bacteria significantly, and even if you take a probiotic to build it up again, you'll never get it back to when you were born. The best bacteria in your gut is what you got when you were born and passed through mom's vagina, and then you breastfed. Those two bacteria, lactobacilli and bifidobacter, are really important. That's what I have in this thing, lactobacilli and bifidobacter. If you can also have, depending on the disease process, Saccharomyces, also a very good bacteria. I'll put a list of the other bacteria that might be helpful for you. But again, if you have all this stuff and you're not taking enough fiber, soluble especially, and fluid to match, then you're going to be irritating your gut. And the only thing the gut does, remember I told you that that tube, the only thing it can do to protect itself is spasm, and then relax and spasm. The other thing it does when it surrenders is if it's constantly being irritated, it just enlarges. And when it enlarges, it goes from garden hose diameter to fire hose diameter. And that's why you can get bloated so fast. If you gain 3 or 4 inches in size, it's because of the gut trying to protect itself. So fiber is very important because what I mentioned. Fluid also important because if you take all this fiber but no fluid, you'll get backed up. Sometimes you can take fiber in pill form, although this is really pricey, but sometimes an easy substitute if you're traveling all the time. I would always say that it's important to have a relaxation practice, and in addition to that, especially if you have IBS, IBD, Crohn's disease, omega-3 fish oil for healthy balancing of omega-3 to omega-6, anti-inflammatory diet, Mediterranean diet. Also helps with joints, depression, and cholesterol. And ashwagandha. I think ashwagandha is very important for relaxing. This is considered an adaptogen, and according to Consumer Labs, believe it or not, the ashwagandha by Vitamin Shoppe actually rated that it had it in the capsule. So pretty good. I usually give this to my folks who have problems in the morning with excessive stress. In the morning and at night, great adaptogen. I put this as a reminder. This is peppermint oil. The peppermint oil helps when it's enteric coated. It's ancient as far as its benefits for IBS, IBD. Well, they didn't have those diagnoses back then, but problems with the belly. But it has to be enteric coated. And I mentioned this on the, I think I mentioned it on my Windy City Live appearance. The only problem is if you don't take it enteric coated, this actually will flare up GERD, gastroesophageal reflux. So you want to get this stuff past the stomach into the small intestine, and it's great. I use the topical oil. I use the oil for a topical application. I think like with taking care or using acupuncture points, this works great for the stomach and bloating and pain. But if you can get it enteric coated and take it in capsule form or liquid form, even better. Obviously, going with a mostly whole food plant-based diet as far as fruits and vegetables, very important. You'll have to work into that because of the fact that most of my IBD, IBS sufferers will have irritation to a lot of fruit or a lot of those sinister 7 food groups. So a little bit at a time. And then avoiding the crappy stuff. This is my model that I take to all my lectures, and it's from 2011. Still looks halfway decent. I don't see any mold on it. And this is my steak, egg, and cheese bagel. But usually I'd have these every Monday, Wednesday, and Friday with a large McDonald's coffee in addition to 10 packs of sugar. And I don't think the coffee or caffeine is healthy either, and neither is the sugar. Truthfully, neither is the sugar substitutes. So you have to really be careful about balancing sugar, well, decreasing sugar altogether, but balancing macronutrients like proteins, carbohydrates, and fats properly so that you don't go too tight or too restrictive. That's when you'll lose weight and you'll not have any building blocks for repairing the lining and producing a healthy gut. But then, again, balancing that with taking too much is really important. Sometimes you have to have somebody helping you on the outside, like a nutritionist, a registered dietitian, or a coach. Having accountability to somebody will make your efforts in a restrictive diet and trying to get to a healthy point a lot more sustainable.